I was a musician. I played San Francisco, Reno. I played at the jailhouse for the women. Played all over Oakland. When my house burnt down, I couldn't handle it when my mom died. Nick talked me through it. And that was a good thing, because now I feel a lot better. I'm not as depressed as I was. He's just like my own son. He helps me with everything. I can talk to him, and he get rides from me when my car is down. He's a very good person.
My work is pretty amazing. To be able to interact with folks everywhere, not only in the clinic, but also in hospitals, in the community, and in their homes. Care Neighborhood is a program that targets the most vulnerable members of our community. We provide intensive case management services to really focus on patients' goals. I help patients schedule appointments. I help do little things like little reminder calls. I help with paperwork.
I'm dyslexic, so he helps me with my writing.
The lesson really that it's taught most to me is how real the barriers are that patients face in accessing care every day.
Community health worker is someone who outreaches to patients, meets with them either in the clinic, in the community, over the phone, working on their health goals, connections to community resources. Care Neighborhood is a case management and care coordination program for patients who've been identified as high risk or at risk, trying to figure out what is in the way of them really taking ownership of their health and their care and trying to empower them. Care Neighborhood has actually been designed in such an amazing way. We have Thursday meetings at CHCN for 3 hours every week. We have an hour of ongoing training. We have 2 hours of case review every week where we talk about difficult cases that might come up for the different community health workers. Our doctors come to those and they present the medical half to help us understand the medical components of these patients. We do what we call hive mind, so everyone can put in ideas, which means if I have somebody who is coming to me in Berkeley, but they live in Hayward, I can put a call into one of our CHWs in Hayward and say, hey, can you help me find resources for this person? I'm not familiar with your area. And we can connect them with those resources because we have such reach. We also have our own systems that we use for Care Neighborhood for just tracking the work that we're specifically doing. They send us to a lot of trainings to develop our own personal toolboxes. I'm working my way towards becoming a physician, and Care Neighborhood has been such an amazing opportunity for me to grow some of those skills and get experiences.
Care Neighborhood has given me the opportunity to work with a really broad range of healthcare providers as I pursue a career in medicine. It's really given me the chance to deepen my understanding of how the social determinants impact someone's access to health and of course their health. That's something that I'm going to take with me into my future practice, and it's one of the reasons I want to come back to the community clinics in the future as a provider. What keeps me going is really the patients. Every day it's the patients, because they're the ones who are motivated to do this. It's their lives, it's not mine. It's their story, and they're the ones who keep pushing, and I feel it's only right for me to give them 110%.